Let's dive right into this explainer with a pretty staggering fact. Every 30 seconds, someone loses a leg to a diabetes-related complication. But here is the absolute most important part of that statistic. Most of these are entirely preventable, and today we're going to talk about exactly how.
Welcome to today's explainer. I'll be your clinical guide, and we're going to walk through how skilled home nursing actively saves limbs. If you're watching this because you or a loved one has diabetes, or maybe you're managing a parent's care and you're feeling anxious about a real foot wound right now, take a deep breath. You are in exactly the right place. We're going to calmly look at how hospital-level care, delivered right in your own living room, truly changes everything.
Here's a quick look at our agenda. We'll cover amputations are mostly preventable, why diabetic wounds are dangerous, warning signs not to ignore, more than just a bandage, hospital-level care at home, and finally, daily habits for healthy feet. We're going to unpack this clear, step-by-step care plan to help take you from feeling anxious to feeling empowered.
Section 1. Amputations are mostly preventable. The hope in early intervention. Since it's Wound Care Awareness Month, the single most crucial point I can share with you today is that while diabetic foot ulcers are a leading cause of amputation, early, consistent care means most limbs can absolutely be saved. Moving to Section 2. Why diabetic wounds are dangerous. The 3 overlapping risks. Let's look at how diabetes actually changes your body's natural healing process. First off, I want to completely remove any shame or stigma from developing a wound. It happens. People with diabetes simply face 3 specific, overlapping physical risks that just make these foot wounds uniquely dangerous. The first risk is a concept called neuropathy. Put simply, it's nerve damage that stops you from feeling injuries. This means a blister, a cut, or a pressure sore can pop up and worsen silently for days, simply because you literally can't feel it happening.
Now add 2 more factors into the mix. You've got poor circulation, meaning a lack of oxygen getting down to the tissue to help it repair, and a weakened immune response, which lets infection spread faster and fight back harder. When you combine those 3 things, no feeling, low oxygen, and immune changes, a minor scrape can become deep, infected, and limb-threatening in a matter of days. That is exactly why treating it early is everything.
Section 3. Warning signs not to ignore. When to pick up the phone. If you're sitting there right now worrying about a foot sore, let's calmly go over the specific warning signs that mean you need a professional right away. No panic, just action.
Listen, any cut, blister, or sore on the feet needs attention, no matter how tiny it looks. Please skip the over-the-counter ointments and don't just keep an eye on it if you see any discoloration, redness, swelling, drainage, or if you experience a complete lack of pain. That lack of pain is a silent, blaring alarm of advanced nerve damage.
If you're looking at a wound right this second and you're worried, you need a professional. For families here in Palm Beach County, call Focus Family Care at 561-693-1311. Call them before it turns into an emergency and just talk through your options with skilled nurses who specialize in this exact thing.
Okay, Section 4. More than just a bandage. The clinical process of healing. We've got to completely move past this idea of just slapping a bandage on a diabetic ulcer. Real skilled wound care is a rigorous, scientific process.
There is a massive difference between trying to handle it yourself with a wait-and-see approach versus utilizing clinical wound care to actively save your foot. Professional assessment, tracking infections, and using evidence-based protocols, that's what makes all the difference in the world.
Skilled nurses use a highly structured, step-by-step clinical pathway. They assess the wound, perform debridement, adapt their dressing selections as the wound evolves, monitor for infections, ensure proper offloading, and teach you how to protect yourself. Plus, they coordinate directly with your doctor, so everyone is on the exact same page. Let's break down a couple of those clinical terms. As part of this process, your home health nurse will manage something called debridement. In everyday language, this just means carefully clearing away the dead or infected tissue. Why? Because doing that gives the healthy tissue the room it needs to rebuild and grow. They'll also set up offloading, which means taking physical weight off the area using special footwear or boots. This is absolutely critical because honestly, even the best dressing in the world cannot win against the constant, repetitive pressure of walking on a healing wound. Section 5. Hospital-level care at home, the living room clinic. Let's talk about why bringing this high-level clinical care straight into your own living room is actually your best strategy for healing, rather than always driving to a wound clinic. Think about it. Home-based care works incredibly well because the care follows the wound's actual schedule, not just whenever the clinic has an open appointment. Plus, keeping immunocompromised patients out of busy waiting rooms drastically reduces outside infection risks. And let's be real, patients are just far more likely to stick with those tricky offloading protocols when they're supported in their own home. And here is, hands down, the most reassuring part of this entire explainer. Medicare frequently covers this skilled home nursing completely for qualifying patients. If you meet the criteria, that means you get hospital-level wound care delivered right to your living room, often with zero copay.
For families here in Palm Beach County and South Florida, Focus Family Care brings these specialized nurses right to your front door. All you have to do is call 561-693-1311. Don't try to navigate this complex healing journey alone when expert home health is just a phone call away.
Section 6. Daily habits for healthy feet. Staying on the side of prevention. We've talked a lot about healing, but let's shift focus to the easy, daily routines that will protect your feet before a wound even starts and keep them safe long after the current one closes.
The secret sauce here is consistency. Preventative habits like doing daily mirror checks, never going barefoot even indoors, and wearing properly fitted shoes are total game changers. And hey, since it's Men's Health Month, I have to point out that these habits are especially vital for the guys, who are statistically much less likely to notice or report a sore spot until the real damage is done.
Always remember, there is absolutely no such thing as a wound too minor to check. If you have a sore that isn't healing right, get the experts from Focus Family Care involved early by calling 561-693-1311 to explore your Medicare-covered options.
I want to leave you with this one final thought. Are you ignoring a minor symptom today that skilled home nursing could easily prevent from turning into tomorrow's emergency? Take action today, get the professional help you deserve, and keep yourself safely on the side of prevention. Thanks so much for joining me for this explainer, and take care of those feet.